Hi, this is one of the very important videos regarding the cholesterol and to understand a misconceptions about a bad cholesterol. So I keep seeing patients who come to me with all these online reports with many online platforms. When they see this cholesterol reports or HbA1c, they get anxiety and they immediately rush to the doctor to get medications and to get some advice on how to control cholesterol. Here is when you see your cholesterol, or more precisely a lipid profile report, there are many components are there. This total cholesterol, LDL, people popularly call it as a bad cholesterol, HDL, a good cholesterol, a triglycerides, triglyceride HDL ratio, and there are so many other ratios also there. I'll make you understand only these three things: LDL cholesterol, triglycerides, and triglyceride HDL ratio. If you understand these things, you almost it is done. Sometimes no need to even consult a doctor also. First comes total cholesterol. Suppose if the total cholesterol is very high, like 260, 280, 300, that alone doesn't mean that you have a risk for a heart diseases. So more or less, for the interpretation to know the risk of heart diseases, total cholesterol is like a garbage. So what you have to look next? You have to look at the LDL cholesterol. That is, people call it as a bad cholesterol. Why it's called bad cholesterol? Because in the Framingham heart study, it was said that it was if the LDL is above 200 milligram per deciliter, you have high risk for developing heart attack. Suppose if your LDL is less than 70, you have very little risk for a heart attack. This was the more or less interpretation. Here the question is, this is less than 70 or less than 100 also okay. If your LDL is more than 200, you have a high risk. If your LDL is less than 100, low risk. What your LDL is between 100 to 200? If the LDL is between 100 to 200, actually we don't know whether you have really having a risk factor for heart disease or not. This is very, very important things. If somebody is having very high LDL, without doubt, you have to start a dietary modification. You have to start a statins to control your LDL cholesterol. And if its LDL is less than 100, up to 130 is okay. Then there is actually no risk, no need to start any statins. And if the LDL is in between 100 to 200, then we cannot conclude whether you really have a risk factor for a heart disease or not. Then what to do? When the LDL is between 100 to 200, then we have to go for other parameters like triglycerides and triglyceride HDL ratio. So before going there, I will come, what is this LDL? So among all the lipid profile components, LDL is very popular. Because LDL is popular because they first discovered a drug for that. The statins came to lower the LDL. So as I cannot explain, whichever having a drug that become popular. So it's a big industry behind that. So this LDL has two fractions. One is a large density LDL, another is small density LDL. In that LDL, 80% is usually large density LDL and 20% is small density LDL. But important thing to note is this large density LDL is harmless. It doesn't pose any risk for your heart. It is a body's compensatory mechanism. And small density LDL is there, no, this is 20%. This is dangerous, harmful, and this is risk for the heart. But unfortunately, most of our labs, including the labs in any big hospitals, they won't measure this LDL into fractions. These LDL fractions can be measured only by NMR fractionation method. They mostly use it for research purposes and in specific cases. Otherwise, routinely, if you do test in anywhere in any hospitals or online, they won't measure this LDL large and small fractions separately. So obviously, we don't know if you have high LDL, we don't know whether you have a small density LDL or large density LDL. There's no point in taking a statin drugs to control it. So suppose you have LDL is 130, 140. If you simply take a statin drug, you go to a doctor, the doctor will prescribe you a statin drug to control it. Remember this, your statin drug controls only this large density LDL. Statins have no effect on this small density LDL. As I explained, the small density LDL is only the thing which is causing you more harm. But statin has minimal effect on this. Statin basically controls this large density LDL. So still, even if you reduce your LDL with the statins, still you have a risk factor for the heart diseases. So then what to do? How this small density LDL can be reduced? This small density LDL can be reduced by cutting down refined sugars and by cutting down your insulin resistance. That is completely dietary. Cut down this refined sugars, processed foods. That will reduce LDL small density and that will reduce the risk. So LDL high doesn't mean that you have all the risk for a heart diseases. So I just summarize, if the LDL is less than 100, it is completely safe. The LDL is more than 200, there is a risk. Then you have to start some medications and also dietary modifications. If the LDL is between 100 to 200, then there is always a confusion whether you really have a risk or not. In such case, you have to go for another important component of the lipid profile is triglycerides. The triglycerides, if it is anything more than 150, you are having a risk for a heart disease and you are having a metabolic syndrome. The metabolic syndrome can lead to many other metabolic problems including diabetes, hypertension, PCOD and so on. So you have to keep your triglycerides less than 140 always, and if you keep it less than 100, it is still good. And to improvise further, simplifies, you have to take a ratio of triglycerides and HDL. HDL is called as a good cholesterol. Suppose if you have a triglyceride 150 and HDL around 50, the ratio is 1:3. To be risk free, you have to keep your triglyceride HDL ratio less than 2. Less than 3 is okay, but less than 3 is always better. So if you keep your triglyceride 100 and HDL 50, almost it becomes less than 2. So this is about total cholesterol is a garbage and your LDL depends on which LDL you have, whether you have a large buoyant or small density, and large density LDL is controlled by statins. Focus more on the small density LDL that is controlled by your lifestyle and diet. And more important is triglycerides and triglycerides HDL ratio. And this is everyone has to know, because cholesterol means people get scary, they think we get a heart disease and all. But to read the lipid profile, this is not a rocket science. As a general population, you must understand the basics about your triglyceride and HDL ratio.